everybody. Welcome to our lecture for Chapter 18. This is going to focus on the basics of infant and child health. And the goals of the chapter and the part I'm going to focus on first is to describe the stages of infancy through adulthood, then identify standardized screening tools that we use for child growth and development, identify the indicators of average physical child growth, define primary terms related to child health, and then we're going to talk about immunizations and recommended schedule for immunizations, and then a little bit about the medical specialists that treat childhood disorders. So as we think about birth and the development of a baby, the first thing that happens is prior to birth, you have two stages, but the one closest to birth is called the fetus. Earlier on, it's an embryo. And then at the time of birth, we call that person a neonate. And that's the first 4 weeks of the person's life. Infancy technically starts at 1 month to 1 year. Then toddler is 1 to 3 years. Childhood is ages 3 to puberty. Puberty is ages 11 to 14, but it actually varies quite a bit. And then adolescence is the teenage years through young adulthood, currently gauged at about age 14 to 21. A note about puberty, though, is it does vary from individual to individual, with individuals starting as early as 8 years old and others as late as 16 or 17 years old. When a baby is born, they do something called an APGAR score, and in the first 5 minutes of a baby's life, and I'll give you a little story about this. My son Benjamin was born with a knot in his cord, so at some point as a developing fetus, he had swum through his umbilical cord, made a knot in it, and during birth that tightened up. And he was not breathing at birth, and they were trying to get him to start breathing. And so initially he was failing the APGAR score because he wasn't breathing. And so the respiratory effort was a 0. But he was a large baby. He was 9 pounds, 13 ounces. So he overall looked healthy. And it was very stressful, 5 minutes while they were trying to get him to start breathing. Eventually he started breathing, and everything kind of started to normalize, the heart rate, and he was then continually assessed. He went to the neonatal intensive care unit called a NICU, and then after a day was released from that. But he was a very large baby, but had this initial health concern. Prior to disease or discharge from the hospital, they often do blood tests for genetic diseases and hearing and heart function tests, things like a pulse oximeter. And they had a pulse oximeter on him his whole first 24 hours because they were trying to figure out if he was getting enough oxygen. A lot of times early childhood deprivation of oxygen can cause some pretty serious developmental disorders, but we were very lucky with our son that he did not end up with any of those. Now we're going to talk about growth charts, and when you have healthy child visits or well child visits, over the first 2.5 years of life they recommend about 11 of those, and then annually from age 3 to 21. And people will use growth charts to figure out how a baby is developing relative to other individuals, to look at things like height, weight, and head circumference. And those things help identify whether there are diseases or abnormalities for a particular child. They use different charts for males and females. Unfortunately, they have not really adapted this to individuals who do not identify as male or female, and eventually I suspect that will happen. That identification doesn't usually happen until a child is around 10 years old at the earliest, but sometimes it does occur earlier, where a child decides to identify as non-binary or as a different gender than what was assigned at birth. And the illustrations in the textbook follow the old sexist code of pink for girls and blue for boys. But you can see here that if you look at the early stages of this, up to say age 9, boys and girls tend to be fairly similar. But as after puberty, boys then tend to grow quite a bit more and become much taller and heavier. So early on, boys and girls often are similar in size, and often when girls go through puberty at an earlier age, they become taller than boys for a little while, and then boys eventually develop further. In birth to age 2, so the neonate, in the birth process, the intrauterine to extrauterine transition, which is what we would call the birth process, they often lose 7 to 10% of their weight, but that's regained within the first 2 weeks. At the first month, there should be a weight gain of about 1 ounce per day. And by 3 to 5 months, the baby should be approximately double the birth weight. Motor skills start to develop. Things like smiling, rolling over is one that can be surprising for people because they say it's supposed to happen at, say, 4 months, and if your baby starts rolling over earlier than that, you often have a baby that rolls right off a changing table and crashes to the floor. I can say this from personal experience. They now are recognizing that breastfeeding provides optimal nutrition, especially things like nutrients and antibodies. The colostrum is the first milk that comes out, and then often babies, because of issues with nursing, end up consuming formula, which is manufactured from cow's milk, and then weaning typically occurs anywhere between 1 and 2 to 3 years now. They're recommending longer periods of breastfeeding now, but historically it was approximately 1 year that they would recommend. And then transition to solid foods. You start to introduce solid foods at about 4 to 6 months, and look for tolerance of certain foods and intolerance of others. Another way to measure healthy growth is to look at tooth development, and some babies get their teeth pretty early and kind of follow these charts here. If you look here at the central incisors on the top, 8 to 12 months, and on the bottom, 6 to 10 months. So the bottom 2 teeth come in a little bit before the top 2 teeth. And you can see then when they're lost. Teething is one of the most challenging parts of early childhood development because there is a lot of crying and irritability with children, and you can't distinguish that from whether they have some other illness going on. Ages 2 to 20, the expected growth rate is about 2.5 inches per year. During adolescence, you get a growth spurt that can last anywhere from 2 to 5 years. And they often look at your parental height and then figure out what your height potential is from that. But puberty can change that quite a bit. I had one son who grew quite a bit during puberty. He went from 5 feet 2 inches tall to 6 feet 4 inches tall. And I had another that didn't grow very much, going from about 5 feet 7 inches tall to about 6 feet 2 inches tall. So that growth that happens during puberty can be a little different than what might be expected just by measuring mid-parental height. Menarche is the beginning of menstruation, and then a condition called precocious puberty is when puberty comes early, and that's ages 8 in girls or 9 in boys. And you can imagine, you may have had friends or you may yourself have experienced this, but for most girls it's 10 to 12 years old, and boys it's 11 to 14 years old. So there's something called the Tanner staging, and this is a way that the medical doctors and healthcare professionals assess whether an individual is starting to go through puberty. And you can see the pubic hair as well as genital growth that occurs during puberty, and people will talk about what stage of the Tanner staging an individual is in based on these things. And then a little side note, nutrition is very important during these stages. One of the things that people will often do is try to use low-fat diets for individuals, especially if an individual is overweight. And it turns out that dietary fats are very important in developing brain for brain development. And if you have a child on a low-fat diet, it can actually impact their brain development. So lots of things to be concerned about. If you end up being early childhood specialist, you would then start to look into some of these things. But many of you will be parents, and as parents, this is also relevant to you. Childhood immunizations, we're hearing more and more about. These are vaccinations that children get. And there are a lot of them in the first couple years and all the way up to age 12. We get natural immunity or passive immunity. You can get that from your mother passed through at birth. And you don't need an antigen or exposure to the disease to develop this passive immunity. Active immunity is either having had a contagious disease, so been exposed to the actual pathogen, or being vaccinated against a contagious disease. There's a schedule for childhood immunizations, and the textbook describes a lot of this for 16 different childhood diseases. Here you can see the immunization recommendation chart, and you can see at birth, 1 month and 6 months, they represent they recommend hepatitis B, the DTaP you can see, and others start at 2 months, and many in the DTaP cycle. And then you have things like varicella, which is chickenpox, measles, mumps, rubella, and then Hep A after 12 months. But you can see this is a lot of immunizations, and these are stressful because babies then do tend to cry during immunizations, and parents then are looking for ways to reduce stress on their children, and may choose not to do vaccines. And this has become a very contentious issue, and we're starting to see things like the return of measles because of low rates of immunization. Finally, let's talk about some of the medical specialties related to infant and child health. So a neonatologist is a physician that specializes in diagnosing and treating disorders of the newborn. Pediatrician, who you all saw as children, is a person specializing in diagnosing, treating, and preventing disorders and diseases for infants and children. And that field is pediatrics. We have adolescent medicine physicians, and these people are kind of rare. Mostly it's pediatricians that cover that whole range. You have pediatric dentists that specialize in children's teeth. You have child psychologists, which is what my wife trained as. child psychiatrist. The difference between psychologists and psychiatrists we covered in the previous chapter. But one of the common things they deal with are things like ADHD. And then there are other medical specializations. Pediatric oncology, for example, are people who specialize in treating cancer in children. Right. So from here, you're going to learn the remainder of the chapter on your own. It focuses a lot on pathology of infant and child health, and then diagnostic procedures for infant and child health. And with that, hopefully then you're well prepared to take the exam and do well on the parts from chapter 18.